To the final session for the day. We have some exciting events afterwards, but I'm glad that you could all join us for this one. So as you are aware, this is one of the industry tracks for the day, and I'm very excited to invite our first speaker, Martin Clark. He's the Director of Sales for the EMEA region at CSAM Public Safety Software Solutions, and he is going to be presenting on creating time to care. Welcome.
Hopefully you can all hear me. Great. So good afternoon. So as you just said, I'm Martin Clark from a company called CSAM. We're going to give you an overview of CSAM because you may not be aware of what we do and of our origins, and then dive into a little bit deeper detail in terms of one of our particular solutions which might be of interest. So in terms of where we are, you can see there, we are a highly specialized healthcare software solution company. We had our origins in the Nordics, but we very rapidly growing to move across Europe, UK, Western Europe, and beyond. And we are all about public safety. It's kind of what we do. And I guess our mantra is around, every second counts, and time is of critical nature in the work that we do and how we supply and provide support for our clients. So in terms of where public safety sits, you can see there, CSAM is made up of 7 business units with quite a diverse range of solutions. And I sit, and my colleagues here today, within that public safety part of the business unit. And so what I'm going to do now is just, now you know exactly where we sit, is show you where we largely operate. So some of you may recognize this as the acute and emergency care pathway. This is based on the source from the World Health Organization. And you can see, as most of us know, within public safety and in emergency medicine and surgery, that this pathway is a very, very complicated system, many moving parts, and lots of independencies and handovers during that patient journey from where the patient or their relative may raise a call and receive that call, right down to the point where our journey ends, where the patient is handed over at ED. And obviously the essence here is time, speed is absolutely critical. We're also developing a future set of propositions which moves us into the hospital space, particularly around theatre and around outpatient activity. But for the purpose of this presentation, it's going to be focusing on our current key competencies, which is around that pre-hospital part of the pathway. So, as we said, every second counts in public safety, and I think we truly believe that our USP in this particular part of the industry is that we touch and support every step within that critical pathway, right from the point, as you can see there, a call comes in, patient needs to be triaged, right to the end of ambulance handover. Now that, for us, is where the journey ends, but obviously for the patient, that journey continues further on. But that's our kind of start and end point. And for the purposes of this afternoon, I'm going to concentrate on the solution called Optima Predict, which is aimed at trying to help our clients who are typically ambulance services to help them better plan for the deployment of those ambulances, whether they're trucks, motorcycles, cars, rapid response vehicles, or airlift services. So it's quite a mixed vehicle fleet. We basically help our clients to simulate the activities that go on in their day-to-day activities and operations in a very safe environment. So they can, for example, start to model differences in ambulance or crew mix or fleet mix, and see what those impacts of those changes and those experimentations, if you like, in a safe environment will make on the response times, because that's critical. Most of our clients have very, very tough response times to a call, to the point of then getting an ambulance to either a patient's home or to a critical instance at the roadside, for example. You'll see also that we've got a number of KPIs or flow KPIs, and those will range from clinical outcomes through to trying to help them reduce delays within this pathway, because very often, as I said before, many moving parts, lots of opportunity for delays and handover failures within that pathway to occur. In terms of productivity, again, many of our clients are asking for improvements in productivity. Obviously, with the the pandemic of COVID, a lot of demand's been placed on those services for pre-hospital and also obviously acute respiratory in particular. And there's a lot more emphasis now. We see that, unfortunately, that we're going to have to start balancing the books. Put it in simple terms, public health systems are under an awful lot of economic strain, understandably. So we help our clients to look at how we can improve the productivity of their services, but also looking at how we can maybe reduce some of their costs, again, because we're living now in obviously a very cost-conscious time with our customers. We're also trying to look at ways we could start to innovate, not just around the technical solutions, which we constantly do, but also around the commercial models. So some of our customers are looking for things like value-based healthcare, which has been around in the US for quite some time, through to outcome-based commissioning, which is basically a provider gets paid for delivering a certain level of improvement or improvement of outcome or cost reduction. What we're keen to do is work with our partners to make sure there's a very balanced number of metrics, that we don't get overly focused on one at the expense of the other. So that's kind of work in progress. But you can see at each point in that pathway, you can see CSAM is there to provide support with various solutions that we have to offer. In terms of the patient flow within the ambulance sector, we're seeing an awful lot, certainly in the UK, where the ED or A&E accidents and emergency departments are getting really, really backed up to the point where if an ambulance comes to convey a patient to their home, typically that handover time from ambulance arrival at the scene to handing the patient over at hospital should be about 30 minutes. At the moment, in the UK in particular, they're trending at around about 2 hours. So you can imagine there's a huge, if you go back to our slide, if you've got a patient who is kind of sick, 2 hours waiting in a hospital ambulance with a paramedic with limited resources, that patient suddenly then becomes critically ill. So this is where we recognise that working very closely, there are certain things that our customers can do. So an ambulance service has, at the moment, little influence on those handover times, but it's impacting really heavily on the ambulance service's ability to get out from the hospital, release them time to care, and then get on to their next job, which comes through the triage service. So typically, if you can think of, let's say, having, and unfortunately in the UK, there have been quite a lot of press coverage where ambulances within the UK in particular have been backed up, 15 or 16 ambulances waiting outside A&E. It's not good. If you were a patient or a loved one, somebody in that ambulance is waiting 2 hours, you want them out of there as quickly as possible. Now, we don't have the answers to all of these things, but what we do is enable our clients, and I'll go on to the clients that we've got in our current customer list. We enable our clients to provide evidence of the impact that those delays are having, either on patient outcomes, or very often an ambulance trust needs to go back to the commissioner and say, look, the problem actually isn't with the ambulance trust. this is around the handover time. And so we've been working with our clients to look at benchmarking. So we use some of the data that we get from Optima Predict for them to look at if our worst performing hospital within the particular area was lifted to the performance of the best one, how would that impact on our response times, and how would it impact on getting those patients who are coming in ill, turning critically ill, how quickly can you start turning those patients around? So for our clients who typically have to work through gut instinct, historical data that can be a little bit patchy, using the Optima Predict solution, they're able to start to model safely and do a whole number of what-if scenarios. You know, what if, you know, we managed to reduce the handover time at hospital to 10 minutes or 20 minutes? And it gives them, and we've got some really good examples where our customers have been able to go to commissioners and prove a very strong evidence-based business case which says, look, we actually need more ambulances, different types of ambulances, different types of vehicles, and also start to model if we have different types of paramedics. So it's all around the right vehicle, the right place, the right time, the right resources, with the right people. These are our clients across the globe, and you can see there the ones in orange are the Optima Predict solution. The ones in blue are Optima Live. And these are our clients. You can see there's a mix there. A lot of, in the UK at the moment, we've got London Ambulance Service is one of our newest customers, obviously one of the biggest ones with a 10 million local population. They claim to be the most complex ambulance or A&E system in the world. Whether that's true or not, but they're pretty complicated. And others obviously outside the UK, so we've got other customers. And we're building our customer base. So I think that kind of gives me a few minutes now for questions, and I can hopefully give you some answers. There's my email address. We're on stand 35. If you have any questions, I think I've come pretty close to my time, haven't I? Yeah. Okay. Thank you very much.
Thank you. Gary at EENA. I have a question. Do you have any evidence that the reports you provide to the ambulance services have actually led to some better political understanding and to then a real change in the provision of hospital emergency, for instance?
Yeah, I've got a couple. I think I can probably mention them publicly because they're quite happy for us to do so. So a good example was London Ambulance Service, and I think you hit the political P word, which is quite important. So London Ambulance Service asked Optima and CSAM to look at a complete review of their ambulance stations. They had 68. They weren't hitting their response time, so obviously the commissioner said, well, you've got 68 sites. It can't be the number that's a problem. There's got to be some other factor there. They wanted to move down from 68 down to 8 in London, which was a huge change. We did that for them. We modelled that, and we showed them the impact that would have on the response times. And they actually improved because the critical bit was about the location, not the number. And they hadn't really understood that concept. It's critical where they're located. So we were able to show London that this is the right number, but also these are the optimum locations. Now, coming on to the political bit, suddenly politics got involved, local MPs got involved and said, hang on, are you closing our local ambulance service? I'm going, well, yep, because we're going down to a small number. There are 32 boroughs in London. London Ambulance Service has been forced by the local politics and the mayor of London to say, we're going to have one in each borough. So we want 32. So, okay, Optima said, okay, that's fine, because the solution is very flexible. It's not built on very static parameters. It's very dynamic. It's built on discrete event simulation. We just took the new request, put it through the software from 8 up to 32 in each of the boroughs. And then we gave them a very clear analysis and report on the impact that would have on the response time. Some of the response times actually got worse for some critical patients, and that was very useful for them to go back to the a local government to say, well, you're asking us to do this, but it's going to be at the expense of drop in performance in certain parts. Are you happy to do that? So it's enabled them to push back and say, well, you know, if you want to make that decision, that's fine, but we're not going to take the consequences. A second one was in the Welsh Ambulance Service. So we currently cover the whole of the Welsh Ambulance Emergency Service. And they've been working for a number of years, suspecting that they had insufficient number of ambulances to cover their population. It's a very mixed population. It's got very dense populations in places like Cardiff, and then very dispersed geographical low populations in the outer parts of the coastal areas of Wales and the countryside and mountains. And they've been struggling with their commissioner for a number of years to demonstrate clearly with evidence that the number in absolute terms and also the mix was not fit for purpose. So we did a special project with them. They're an existing user of Optima with some of our consultants, and we worked through with them a number of different kind of reports. The upshot is they've got something like £4 million in the next year to improve the fleet mix and improve some of their site locations. So, you know, without that, the Welsh Ambulance Service would be pretty much seen to be moaning without any evidence. So that hopefully those are two good examples of where the politics and certainly where the evidence, where it wasn't, you know, clear, where Optimus helped to provide that business case. Yeah, thanks for your question. Yeah.
Do you have any evidence where the work of Optima Predict has actually led to an increase of budget for those ambulance services as well?
Sorry, can you?
Do you have any evidence where your work, your reporting has actually led to an increase of the budget of those ambulance services because you were able to show, for instance, that what they needed was actually as well more means?
Yeah, absolutely. And I think, you know, we're fairly aware that there are a mixed bag of KPIs, as we said before. So we try to get some hard evidence, some hard KPIs. So it could be return on investment. If I spend $1 million with you, what do I get in return over which period of time? Some softer ones in terms of the patient outcomes, you know, in terms of increasing the outcomes in patient care, reducing morbidity and mortality rates. So, yeah, we've got a couple, I think, that would. I'm just thinking the best one. Yes, I think we've got South Central Ambulance Service, where they were struggling an awful lot with the numbers of staff, and it was largely COVID related, but also job stress, because, as we say, a lot of the ambulances were are queuing up. Patients are getting sicker, and that's not what a paramedic came on to be a paramedic to do. So we worked with South Central Ambulance Service to look at their staff mix and who should be on duty, sort of rostering with what type of kind of ambulances and the mix between ambulances and rapid response vehicles. It's helped them. It's not complete yet. It's a piece of work, but they've been able to go back now, in fact, to NHS England, which is the highest level, with the Optima evidence to say, you know, you can't compare us with other areas because we started off on a very, very low base anyway. So historically, we proved historically, South Central Ambulance Service per capita population had fewer ambulances and has never received an uplift over that period of time. Without the Optima data, again, it would be unfortunately down to the exec team having to put some, you know, anecdotal evidence, which we suspect or we kind of think they were able to very much challenge with confidence to say, this is fact, and here's the Optima report. So yes, it's not complete yet, but it's certainly put me in a very strong position with a confident business case. Yeah, thanks. Okay, well, thank you very much. That's my time up. Thank you. Thanks.
Well, thank you very much, Martin, and thank you so much for the work that you and the CSAM team are doing. It's incredible stuff. Okay, up next we have a presentation on maximizing your command and control investment. And to present on this, we have the Pulsiam team. I'm very proud to introduce you to Holly Blanks, Director of Global Business Development, and Henry Unger, President of Pulsiam. Come on, team. Come on up.
Thank you.
Good afternoon. Thank you so much for joining us. So the first step in how to maximize your command and control system, we find as we work with agencies around the world, is to not just think of your command and control system as software, to really view it as a unified platform so that you're providing shared information to a common and coordinated effective response amongst all the many resources that you work with. Traditionally, we find that agencies have a habit of purchasing siloed solutions, incredible technology that independently produce results, but could be more effective when working together with other parts and pieces within the public safety ecosystem. So today we want to talk about a couple different ways that Pulsiam works and supports with our clients as far as integrating different solutions together to make sure that they're making the most of their command and control solution. First of all, we'd like to talk about improving caller location. One of the most important pieces in what we do is accurate caller location. So we're proud to work with partners such as RapidSOS, Global Live 3D, Geocom, and Esri to help us in our efforts in making sure that we can find those emergency situations not only as accurately as possible, but as quickly as possible. And with the introduction of the Z coordinate indoor location, we're really excited about being able to improve those services as the technology evolves. Next is analytics. Analytics is a huge trend for us, and in fact, our company made a big shift to incorporating both tabular and GIS analytics as part of our system, and not delivering them as something that's separate, because we really believe that that is a core component in being able to take advantage of all of this data that you have within your system and doing the analytics to improve and improve your responses, as well as predict and be able to prepare in advance. So for this, Henry's going to share an example of what we do in ESTADO de Nuevo León.
Thanks, Holly. So ESTADO Nuevo León is a state in the country of Mexico, and it's certainly one of the larger ones, and they have interesting challenges, and we've provided some interesting solutions to those challenges. One of the problems they face is lots of stolen vehicles. Okay, so what do we do about that? Well, they have a broad array of number plate recognition cameras that are always in the lookout for vehicles that have been reported stolen. There's a central database of license plates that have been reported as stolen, and through video analytics, and our integration with a video management system, the system detects a stolen vehicle and creates an incident in our SafetyNet CAD application, and which pops up in the call queue for dispatch and for response to go ahead and grab that the vehicle and whoever's driving it at the time.
So something else Nuevo León also uses is an app where citizens are able to report their vehicles stolen. So that stolen vehicle database is being updated constantly in real time by citizens using the app, by whether they call in the report. So there are multiple ways for that vehicle to be reported stolen, and then as Henry said, those cameras are helping find it, and the dispatch is automatically sent out, and they're able to track that vehicle from the different cameras and spot its location so that they can figure out where it's going. They also go ahead and take all of this data, and through our software they do analytics, and they're looking to see where are these vehicles being stolen, what time of day are they being stolen, where are we finding them, how are we finding them, and they're able to then go ahead and predict where should we be using our resources best to help try and prevent these stolen vehicles from happening, or undercovering, where they're being left at the end, and try and put some operations in to catch the people that are leaving those vehicles. So the next topic we'd like to talk about is blurring borders by sharing data. Traditionally, agencies keep their information to themselves, but criminals, as you know, do not know boundaries, and they move freely amongst different jurisdictions. And one of the really important things is that we're seeing is agencies are being willing to open up and share that data amongst each other so that they can continue to improve both the recovery of different vehicles. They're able to find trends that perhaps there's not a trend in their jurisdiction, but when they start looking at data outside just their area, they can start to find trends and patterns. So Pulsiam works on many international standards committees. Henry is the chair of a few of them. And one of the important things about that is making sure that we're all able to talk together. So making sure that when you're selecting a command and control system, that it is one that will work and play nicely with others is very important, because you want to be able to share that information back and forth. So an example that Henry's gonna talk about is our SafetyNet automated records exchange program and the system that we have installed in New York.
So we've got a number of different customers in New York, different counties, and like Holly said, criminals don't necessarily obey boundaries. And so there was a need to share information between them. And so we've had this product for quite some time called Snare, where all of the participating agencies will contribute data to a central repository. And then anytime queries are made for things like people or vehicles, in addition to searching the agency's local records as well as state and federal records, that regional records are also consulted. And oftentimes there's a lot more detailed information that's being maintained at a local and regional level than there is at a state or federal level. And so provides much more insight into the people and vehicles and other things like stolen property and guns and things like that. So we were just made aware of a project going on in the state of California, that the state of California has got a plan to be able to share information from amongst all of the communication centers in the state. And I'm trying to, what's the population, like 50 million people? So, so one would think that they probably handle about 50 million calls to 911 on an annual basis. So, aggregating all that information and making it available to all the participating communication centers and other agencies is a very, very valuable source of information.
So another important way to maximize your command and control system is to look at situational awareness and making sure that you are utilizing any siloed solutions in conjunction with other siloed solutions, so that you're able to take these pieces and put them together to have more situational awareness and have a bigger overview of the incident that's happening. We see that many public safety agencies, well, they're all making decisions, mission critical decisions at at a quick notice. And often if they have siloed solutions, they're having to check separate systems. So they're not having one place to look and make that decision. They're having to go to multiple systems before being able to make that decision. So our goal as a command and control provider is to help find ways and interfaces at a cost-effective measure where we can bring all of that information together so the agencies and decision makers have one place to go to make those important decisions. So an example of this that Henry's going to share real quickly is about the Schenectady Police Department and what we're doing there with body cams.
So body-worn cameras is a fairly new innovation. Body-worn cameras solve a whole host of problems, both from an evidentiary perspective as well as a political perspective. And as agencies are acquiring body-worn cameras, it's important to actually integrate these, right? So they need to be able to do far more than just be a camcorder, so to speak. There's a lot of, and also you don't want to have a situation where you're having to manually search through all of this video that has been gathered by the body-worn cameras. So there's a couple of things that you can do with body-worn cameras. Actually, there's several things you can do. Some of them actually provide position reporting. Some of them provide a live video streaming. Others just provide video archiving, right? So we're able to take any one of those facilities, or all of them, and integrate with them with our command and control solution, right? So for those that provide position information, we're able to show them on the map. For those that are providing video streaming, the command and control personnel can actually watch real-time video for any of the officers and any of the units that are assigned to the incident. And in addition, to aid in the indexing and retrieval capabilities, every assignment or status or state change for any of the units assigned to an incident, the footage is stamped with that incident number and what the status was of that particular unit, so that it's very, very simple to go back and retrieve all of the video segments associated with any of the units or officers assigned to an incident for any stage of it, right? So you can say, okay, give me all the video for all the units that were on scene, or all the officers in any units that were on scene for this particular incident, and it just puts it all together as opposed to having to do it individually.
So the final one we're going to talk about is how we can help decrease response times by automating third-party integrations. So public safety is about working together, and it's very important that all of your different vendors work together and cooperate and look for ways to help decrease that response time. We're really excited about our partnership with RapidSOS and their new alerts project, which Henry's going to tell you about. But our goal in the interface was to help decrease the amount of time that it takes from an alarm being signaled, having to traditionally call an alarm company and then work with that alarm company, versus being able to pass all that data and information electronically. So without further ado, Henry, you want to tell them about what we're doing in Washington County 911?
Sure. So as Holly mentioned, traditionally, so there's a bunch of alarm monitoring companies. They monitor residences, they monitor commercial establishments. Most communication centers don't allow direct interfaces to the actual alarm systems in residences or commercial establishments, so you have to have an alarm monitoring company. So it's an alarm monitoring company that gets the signals from the residences or commercial establishments, and they typically pick up the phone and they don't dial 911, but they dial some regular telephone number to talk to somebody at the PSAP and say, okay, well, you know, there's been a burglary alarm at 123 Main Street or a fire at 123 Main Street, and you know, this is the address and this is what the problem is, and you know, it's a very, very time-consuming process, and it's kind of a waste of time, and it certainly slows the response that's possible. So RapidSOS has developed a standard API for alarm monitoring companies and communication centers to use, so to act as a clearinghouse for alarms, you know, both police and fire, EMS alarms, and so a communication center would subscribe for alerts from the alarm monitoring company, and the data would be provided. So there's no more phone call. All the data that you need is provided. In our case, an incident is created in our command and control system, and it's immediately available for dispatch. So again, no call taker involved, just shows up, it's ready for dispatch. And for those of you who are adventurous enough to want to perform automatic dispatching, you know, the alarm can come in and enter into the system, and the system can automatically do a recommendation and dispatch the units without any human interaction whatsoever.
An example of why this is super important: in Mexico, 80% of their calls are false alarms or llamadas bromas, people just checking to see if 911 works in Mexico. So you can imagine when you're looking at that daunting pending queue list, if you had a bunch of alarm calls that were just sitting there, how do you know which one you should take first? So we're really excited about the automatic dispatch feature and those clients that are utilizing it, so that we can keep that pending call clear. When the alarm comes in, someone's going to get dispatched, even if it's just to see what it is. So we're able to keep those officers moving, and then handle all of the llamadas bromas and the other calls that are coming in while these others are being processed automatically. So thank you, Jessica and RapidSOS, for that great innovation. So I think that's about time. We have a couple minutes for some questions. We're located in stand 26, or you can find us online, but we'd love to give you a demo if you want to learn more about the projects that we mentioned today. There's a lot more detail we can share with you, so feel free to stop by and chat. Thank you.
Thank you, Henry and Holly. Okay, so we're finishing a little bit early, so you all get an early mark. Coming up at 6 p.m. in the plenary room, everyone's invited to attend the 112 Awards ceremony. Between now and 6 p.m., you're free to visit the exhibition. You've just seen two fantastic presentations, so I suggest you go and check out those stands and maybe get some demos. In this room from 4:20, the Research Corner session is going to be held in cooperation with ISCRAM, the Information Systems for Crisis Response and Management Association. What that will involve is academic researchers presenting their latest work for the area in public safety. Please do join them to find out what they present, and also to get an insight into the future research projects in the emergency services field. So thank you everyone for attending. Go and check out some exhibitions in the exhibit hall. Oh, hold on, Gary has something to say. Hold on. Oh my goodness. Guys, there are drinks. I'm sorry. Left the most important thing out.
And maybe also they mentioned there will be a speed dating for those of you who are registered. So there's speed dating, pen tables. So we start at 4:00.
Okay, drinks, speed dating, research. What more could you ask for? Enjoy.